This conference will now be recorded.
All right, friends, we're going to go ahead and get started. I see there are still some more people logging on. We're going to go through a couple of things to begin with. We hope to finish this up before an hour and a half, but I did allot an hour and a half just in case we have some questions and some things that we want to talk about at the end of the presentation. On your screen, you should see there is a place where you can unmute yourself if there is a reason to need to do so, but right as of now, I've muted everyone. We also want to be sure that you know that you can communicate through the chat button. I'm gonna post a little message. You can ask questions through that chat throughout if you want us to give it a look at the very end and look at questions that have been submitted throughout, so that we can reduce the interruptions during the program. We are recording this so that we can post it later. We will be doing another session at 2 p.m. At this point, we anticipate that session being identical to this one unless we have some new information that comes out during the day that we need to update. If so, we'll be sure to email all of you guys and let you know that that session will be different. All right, so starting with this screen, I want to be sure that you guys know we don't know everything, and we fully admit and accept and own that we don't know everything. Everything is changing so rapidly and so dramatically. This is information that we have compiled and believe to be correct. And this slide says as of 5 p.m. on March 16th, I actually have added a couple of slides this morning related to some new information that's come out from the Alabama Department of Labor. We know we don't have all the answers, and unfortunately in this situation, we just don't even know what we don't know. But we assure you, we are constantly monitoring, we're constantly watching, we are trying to collect all the information that we can so that we can provide it to you as business owners and business leaders in our community. We recognize that fully that while this virus is highly contagious, is dangerous to special populations, one of the biggest dangers we face in our community is the impact on the economy. And we want to do everything that we can to mitigate that danger, to find creative ways that we can keep our small businesses afloat and our economy as healthy as possible during this time. So let's start with a quick review of preparedness checklists for businesses. The first thing that you can do is prioritize your critical operations. You got to decide within your corporations what positions must be staffed in order to maintain your operations, and if there are any activities that you have ongoing that could be suspended or postponed. We see a lot of folks doing this. For example, we have postponed all of our meetings that we have scheduled for the next 15 days. That time frame may extend, especially as we see new guidance come out from the White House and the state. But at this point, we're working on a 15-day basis. And so if there are things that you can postpone till later, we encourage you to do so. You need to be prepared to change your business practices. For some of us, that might mean identifying some alternative suppliers. Some of you may have trouble getting some of your regular inventory and equipment in. You may have to prioritize some of your customers to make sure that you maintain relationships with those that are most critical. And as we mentioned before, temporarily suspend some of your operations. Obviously, we all recognize as of today, we need to prepare for school closings. The current announcement is that area schools will be closed until April 6th at minimum. We're all gonna experience some absenteeism spikes. As a result, parents are needing to stay home with their children. It is understandable, whereas they may have normally been able to take them to grandma or granddad. those folks over 65 are considered a population at risk, and it's not exceptionally healthy for our young students who have been in large social environments to be going to grandparents at this time. So be considerate that there will be some absenteeism spikes, not just from the school closings, but from potential illnesses. If you have not already, you definitely want to create a communications plan. You need to put some measures in place so that you can quickly and effectively notify your employees. That could be through email distribution lists, texts, a phone call tree. You might have a closed social media page. I will tell you, while we are going to be focusing on telecommunications at this point, we're going to be doing a lot of meetings internally and externally through this GoToMeeting service, which has proven to be great. If you don't have a GoToMeeting and you need to have company-wide meetings, this is a great tool to use. You need to also consider that as more and more employees go home to work or work remotely, that there could be additional strain on the internet infrastructure. So you do want to have a backup plan, something that's a little more, I'm not saying pigeon carrier, but you might want to be sure you at least have all of your staff's phone numbers. If they do still have landlines, those landline numbers, additional ways that methodologies you can get in contact with each other. If you are able, it is a good time to consider whether you telecommunicate would work for your office. Because of the recommendation to suspend meetings in excess of 10 individuals in one spot, for those that can't telecommute, you might want to look at flexible work sites where you're using additional space within your office facilities, where you're not putting too many people too close together. It is recommended that there's a 6-foot perimeter between individuals. That's essentially 2 full arms lengths that you want in between people. You may need to stagger desks in some situations. You might also consider some flexible work hours with smaller shift sizes so that you are reducing large crowds. And obviously, cancel or postpone any of those large work-related meetings or events when possible. Also, coordinating with external health officials. It's not necessarily information that you're feeding up to them, but making sure that you're staying abreast of the information that's coming out from them. The top organizations, World Health Organization, the Centers for Disease Control, Alabama Department of Public Health, which again we just mentioned is holding a press conference right now that's on most of our local channels live. We've got someone in-house watching that, and as I mentioned before, we'll have an update if needed. They'll bring an update in for us that we can discuss at the end of this if we need to. And the Gadsden Etowah Emergency Management Agency, the websites are up here. If you need those sites, you can also Google pretty much any of them and be able to find them. Again, I want to stress to you how important it is that as you consider sharing information on your social media sites, that you be sure you vet that information. We don't want to put false information out there. I know I've seen things that range from ibuprofen not being effective against COVID-19 to gargling will prevent it. This is not legitimate information. Be sure you're getting your information from reputable sources. The CDC and the Department of Public Health and the EMA are not going to put anything out there that isn't fully vetted and verified. So be sure when you're sharing social media, we all enjoy the memes and we've got to laugh to keep from crying at times, but let's make sure that we're sharing accurate information. Keeping your workplace safe. It is currently thought that, outside of pre-existing conditions and the elderly, we're all at a high risk of catching, but not necessarily becoming significantly ill older adults and people with underlying health conditions such as diabetes, lung disease, heart disease, are at much greater risk. And while we may get comfortable in thinking, well, we may catch this, but we'll survive it and it might not be that bad, we have to consider those people that we are also tasked with taking care of outside of our businesses. You want to try to stay as healthy as possible for all of those that you come into contact for, and also to reduce the strain on our healthcare systems, which we're going to talk about a little bit more in the future. So in the interim, these are some suggestions that are coming from the CDC. Stop handshaking completely. No elbow bumps, no side hugs, no fist bumps. Just go ahead and stay 6 feet away from each other. Wave to each other, say hello. No one is going to think you're being rude. Let's just completely suspend that activity of physical contact with each other in community settings altogether. It is a very good practice to go ahead and clean your hands at the door. As soon as you walk into your office, go wash your hands, use hand sanitizer. We do recommend that hand sanitizer be at minimum 60% alcohol based. Every time you enter a kitchenette or a kitchen area at your office, wash your hands immediately upon entry. Be mindful when you're picking up a coffee pot. These are very, very mundane things that you don't think about on the regular, but try to be conscientious. For those that are working in retail situations, if you can promote tap to pay, PayPal, if you can limit cash handling, quite often in cash handling, you actually end up coming in direct contact with another person's hand, or you're getting close enough to them that the spread of virus could occur. Some areas that you want to make sure you're disinfecting on the regular in your offices are doorknobs, tables and desks, handrails, light switches. If you have community computers, your keyboards, your mouse, anything that you might be touched multiple times during the day. When you wash your hands, we are probably all guilty of trying to get in and out of that task pretty quickly. You need to be sure you're washing with soap and water for at least 20 seconds. I think you probably all heard it by now. You can sing Happy Birthday to Me. There, Twinkle Twinkle Little Star. There's a couple of different songs you can sing in your head, sing them out loud, entertain some other people. But wash your hands for at least 20 seconds when you do with soap and water. And if you have coughed, sneezed, blown your nose, gone to the restroom, before or after preparing food, especially when you are in a community setting, if you are using a break room or a work kitchen area, you cannot wash your hands often enough while you're in there, because you are in an area where germs can be shared very easily. You also want to make sure that you're avoiding touching your eyes, nose, and mouth with unwashed hands. And it's remarkable to see how fast germs can accumulate on your hands, within minutes after washing your hands. So be mindful of that. Where possible, cover your mouth and your cough, your sneeze with a tissue. We have, the vampire cough, where we cough into our elbow. That's a good practice, but when you can, go ahead and use a disposable tissue and throw it in the trash. I saw a cute meme where, all those hordes of drive-through napkins that we've stored in our car dashes and consoles will come into good use lately. Those are great ways to use that stash you may have tucked aside for this particular rainy day. We do want to make sure we're avoiding crowding. You want to use booking and scheduling to stagger your customer flow. At current, there are no recommendations that we completely cease accepting customers, but for those that work in retail, this may be an opportunity where you can reach out to your long-term trusted customers that are used to seeing you regularly. You can reach out and say, hey, I'd like to book a private shopping 15, 20, 30 minutes for you, and only have 2 or 3 customers in your shop at any given time, giving them that exclusive opportunity to come in and private shop. where they can rest assured it's been sanitized before and after their visit, and they can get those things that they're used to purchasing from you. Please consider, if you have any ability to sell things online, putting it out there, including PayPal. We do want to make sure our local economy is cared for, and that we can shop local as much as possible. It is so important to keep our moms and pops front of mind during this time. Please be mindful with your meetings and your travel. I do want to mention, we've seen a lot of flights being canceled and rearranged. They're recommending no leisure travel whatsoever and only essential travel. When you fill up at the gas station, that's another time that you need to be mindful of germs with the keypad, with the dispenser itself, the gas dispenser itself. I hope you all have some hand sanitizer in your cars. If not, another great opportunity to use that stash of napkins you may have in your console, where you can at least create something of a barrier between you and those public spaces that are getting a lot of contact. Just as with this, use video conferencing when you can, and plan for some worst case scenarios. I know our staff, if the time comes where we must all work from home, we do plan to use the same video conferencing for daily staff meetings. I will tell you, GoToMeeting right now has a 14-day free trial before you even have to purchase, but the purchase rate is very affordable. If you have teleconferencing capabilities, be sure your staff knows about that and how to access it and use it ahead of time. And if you can avoid any business travel, if you can use FaceTime, Skype, anything like that where you're having one-to-ones but you're having them remotely, now's a good time to go ahead and try to put that practice in place where it works for both parties. A little bit more on food handling. We are always very careful with food handling, and I know our restaurants in the area do a fantastic job. We're seeing several counties in the state enhance their guidelines on the abilities for restaurants and bars to have individuals on premise. They're encouraging some, more to go and off-site service. All of them are implementing a higher level of control. You want to make sure you're strengthening your health screenings for those that are employers for food handling services. You want to make sure you're asking your employees about their health, if they are feeling well, and make sure that they are screened daily about their close contacts, that they're all in good health. It is a good time to avoid food sharing whatsoever. We have suspended our community coffee pots at work. We also, like I mentioned before, are requiring hand washing before each pour. If you have normally, candy dishes or whatnot set out for your staff, it's a good time to just put that away for the time being. I cannot emphasize this enough. If you are sick, stay home. If you have a family member that is sick, stay home. The CDC guidelines are recommending this, and not only if you have a fever, if you have cough, if you have any respiratory maladies, it is not wise to subject others to that right now. I also want to just briefly mention what I feel like has not gotten nearly enough publicity in our regular media to date, and I think this could be one of the most important messages. Our big risk that we are facing is overstressing our healthcare system. In fact, the way that this has progressed in other countries, and we know will progress here, it will overstress our healthcare systems. Do not go visit sick and elderly right now. There could be multiple ways that you could communicate with your loved ones, especially if they're in nursing homes or healthcare facilities. Look for other ways to communicate with them so that they know you are caring for them and loving them and sending them well wishes. Do not go to the doctor if you have mild symptoms or even moderate symptoms. the CDC recommendation is that you call ahead to an emergency room and or to your medical doctor before you go in for a visit if you are exhibiting symptoms. There are additional precautions that need to be taken before you are seen if in fact you would test positive. And so walking into an ER or a doctor's office puts the staff, all other patients there at risk. It is not a safe practice. So be sure that you understand that our healthcare systems need to attend to the sickest first, and those are going to be individuals who have trouble breathing, who are finding it extremely difficult to breathe, and are having extremely high fevers for extended periods of time that are not responsive to over-the-counter methods. And I hope all of you have all of the toilet paper you might possibly need, but it would be a wise idea to have some acetaminophen, some cough syrup, some Vicks Vapor Rub, things at home on hand just in case you do have a case of COVID-19 and you are able to treat yourself over the counter. Go ahead and make sure you have those over the counter medicines because that is the best method for self-treatment at home. These are symptoms of COVID-19, a fever, a cough, and shortness of breath. Let me remind you, though, that you can be asymptomatic and still be contagious. So if you feel sick, again, these are the CDC recommendations. Stay home except to get medical care. If you feel sick, do not go to the grocery store. Do not go pick up food at a restaurant. Do not go out. Reach out to your friends and neighbors and family. See if someone can porch deliver for you. There are lots of people on Facebook that are offering this service free of charge to complete strangers. Stay at home if you are mildly ill with COVID-19. If you believe you may have COVID-19 and you are just mildly ill, isolate and treat yourself with over-the-counter medication. You can give your healthcare provider a phone call and get some advice on how to do that. You want to, even if you are well, avoid public areas. If you are feeling any sort of symptom, don't go to work. Obviously, schools are closed. Do not go to public areas, and avoid public transportation and ride sharing. You want to separate yourself as much as possible. And CDC recommendations are also that you limit your contact with your pets and animals. While the transmission is currently from person to person, this disease is thought to have originated from an animal. However, while your immune system is weak, there are some diseases that can be passed from animal to human. So it's recommended that you, if at all possible, can limit your care of your pets and animals if you should be diagnosed with COVID-19. The reasons you should seek medical advice is if you develop symptoms and if you know you've been in close contact with a person that has been diagnosed with COVID-19, or you live in or have recently traveled from an area with ongoing spread. But again, call ahead to your doctor's office or the emergency room and tell them about your recent travel, your exposure, and your symptoms. I want to talk a little bit about what the state's doing. The House and the Senate has approved a budget amendment of $5 million that will be appropriated to the Department of Public Health. And this money is to be used for testing centers, expenses related to telehealth, covering costs for uninsured for testing and treatment. Essentially, whatever the Department of Public Health determines is going to be the highest and best use in order to contain the spread. Just this morning, and I apologize, this slide's may not look. No, I think it looks okay for you. It just looks strange for me. The Alabama Department of Labor, I saw, had released a press release that workers who are unable to work because of COVID-19 will be eligible for unemployment benefits. There are some eligibility requirements. They'll have to have been quarantined by a medical professional or a government agency, laid off or sent home without pay for an extended period by their employer. diagnosed with COVID-19 and or caring for an immediate family member who is diagnosed with COVID-19. This will go into effect March 23rd. Claims can be filed online. That is the preferred method at www.labor.alabama.gov, or you can call 866-234-5382 to get more information on that. And I want to add that people who are being laid off, that is totally different than people who are being paid to work from home, and they're receiving paid time off. If that is the case, they're not eligible for benefits, even if they meet the other criteria. So if an employee is sick and they have sick time and they're being paid to stay home sick, they don't require for the unemployment benefit. There are some waivers that are typically on unemployment benefits. Those include that a laid off worker should be able and available to work while receiving unemployment compensation benefits. Obviously, if you are diagnosed with COVID-19, you're not able and available to work. That they be able to search for other work, provided they take reasonable steps to preserve their ability to come back to that job. And so what that's saying is, there should be a reasonable understanding that this person is going to come back once they recover from COVID-19 to the job where they are not able to go to because of quarantine. And generally, there is a week waiting period, the first week of compensation benefits. That is being waived as well. But again, remember, this goes into effect March 23rd. Employers that are shut down for causes related to COVID-19 are instructed to treat the situation as a temporary layoff. And now there are some other guidelines and restrictions on this. So there are some exceptions that may apply. And there's some possible federal action coming down the pike. We'll talk a little bit about that in just a minute. And claimants may be required to present verification of illness or quarantine. So I encourage you, if you are interested in more information on this, to check out the Department of Labor's website or give that 800 number a call. So let's talk a little bit about federal activity now. The CDC awarded the state of Alabama over $8 million, $8.1 million, to fight the spread of COVID-19. The SBA has had made available to it economic injury disaster loan programs, and there's also the Families First Coronavirus Response Act that I want to be sure is on your radar. So let's first talk about the economic injury disaster loan program. The SBA is going to work with each state's governor. The loan program is going to provide up to $2 million that can provide economic support to small businesses to help them overcome the temporary loss of revenue that could be occurring while we are experiencing these social distancing measures. I do want to mention that in order for the state of Alabama to qualify for this program, there is a requirement currently that at least 5 businesses per county in the state submit documentation of business losses for the state to qualify. So if you have already experienced some economic loss, or upon the time that you do, it would be something for you to consider to reach out to the SBA to see if you should apply. I am not authorized or able to speak on whether or not you have to accept a loan should you be granted it. But I can say that if we don't have at least 5 businesses per county in the state, the way it is currently rolled out, this disaster loan program may not be available to anyone. Also, the Families First Act, this is how it was drafted as of March 15th. This was discussed briefly yesterday during the White House press conference, and that the act, the way it's currently written, only applies to employers with fewer than 500 employees. From what I understand, it's in the Senate now. It's passed the House. There's a consideration to expand that to larger employers as well. And we will be sure that we update you on that should that happen. So just some high-level overview of that act would provide 12 weeks of job-protected paid FMLA, of which the first 14 days must be unpaid for employees of employers with fewer than 500 employees, that they may use accrued personal or sick leave during the first 14 days, but employers may not require the employees to do so. That the leave benefit covers employees who've been working for at least 30 calendar days. Employees could use the leave to respond to quarantine requirements, to care for family members who are responding to quarantine requirements, to care for a child whose school has been closed as a result of the pandemic. After the first 14 days, employers would have to compensate employees in an amount that is not less than 2/3 of the employee's regular rate of pay. These pay requirements apply to only the COVID-19 related leave reasons listed above, and the provisions would go into effect 15 days after the date of enactment and expire on December 31, 2020. As far as paid sick leave, employers with fewer than 500 would be required to provide full-time employees 2 weeks of full 80 hours of paid sick leave for specific circumstances related to COVID-19, such as self-isolation and doctor's visits. Part-time employees are entitled to the number of hours of paid sick time equal to the number of hours they work on average over a 2-week period. Employers must compensate employees for any paid sick time they take at their regular rates of pay. They're required to post a notice informing employees of their rights to leave, and as currently drafted, the bill would expressly provide that it does not preempt existing state or local paid sick leave entitlements. And that provision would also, if this bill passes, go into effect 15 days after the date of enactment and expire on December 31, 2020. And then as far as unemployment insurance, it would provide $1 billion in emergency unemployment insurance relief to the states, $500 million for costs associated with increased administration of each state's program, and $500 million held in reserve to assist states with a 10% increase in unemployment. Besides the necessary increase in unemployment, in order to receive a portion of this grant, the state must temporarily relax unemployment insurance eligibility requirements, such as waiting periods and work search requirements. These are a few resources to check regularly. As far as business guidance, there is some tax relief rollouts going on, irs.gov/coronavirus. There are some assumptions that there will be extensions on payments and filings. Again, keep check on the Small Business Association, sba.gov. We have also established a landing page on our website that links to some CDC guidance, and we are also collecting local resources that are available. I know we've had a call from a couple of folks that they have some cleaning services, some fogging services for businesses should they want to make sure that they've eliminated the virus within their facility. We are collecting any type of resource that you have available for sale, especially related to this outbreak in a special way, and we are linking them from this /COVID-19 page, along with some quick tips and resources specifically for businesses. If you have something you want to send to us, you can send it to Will Mackey at will.mackey@etawaChamber.org, or you can send it to info@etawachamber.org, and we'll be sure we get that posted for you. We recognize that we all have some really tough decisions ahead, and so as we do, we want to be there for you. We are here to help brainstorm with you. We all need to think about how we can transact online. We need to think about how we could add value to our clients and our customers. This webinar in itself is not something that we had ever anticipated needing to provide to chamber members. It's unfortunately what we're going to have to do, and we are prepared to do for the foreseeable future, because we want to be sure that we're providing all the information to you that we are receiving. So think about you as a business owner and a business leader. What can you do for your clients and customers that could be an additional added value that you can provide, and to keep your relationship strong. And again, I cannot stress hard enough that you share only vetted, legitimate information from trusted sources. I do want to add from the comments here, if anybody has any questions or any comments that they want to add, I do want to note, going back to the SBA loans that Back 40 and Tangmart have already submitted. So there are 2 of the 5 that are required for our county. There may be others that have submitted that we're not aware of. Looks like Coosa Behavioral has too. Again, I just want to stress to you that unless that we have 5 from each county in the state, we may not as a state qualify for this. So if you have relationships with businesses in other counties that may not know about this, please direct them to the SBA.gov website and let them know that this is something that we need to have on our radar. Let me double check and make sure there's nothing that we need to share from. Hey, Miranda, did the ADPH have anything that we need to update on? I apologize, I don't think she's in her office. So I think that is it for now. Again, we'll open the chat to any questions, or if you want to unmute, I would say be mindful of it. It looks like we got about 40 people on the call right now. To ask a question, please do so now. We'll give it just a minute, and then if there are no questions, we'll convene this call. There is a link to the SBA disaster page. Let's go back to that. There's also a question of, is there a possibility that phones and internet could be affected? Yes, there's always a possibility. As the load increase occurs, there's a possibility. I think that's what we need to be mindful of, and having not just a plan, but a backup plan in order to communicate. And the phone systems hopefully are not as volatile. I'm going to move this page over, I think, so that you can see it. This is the SBA administration page specifically about the coronavirus. If you click this economic injury disaster loan program page, and then SBA.disaster, this is where you apply for assistance. I will send the slides to anyone that wants them. I see some of you are asking for them. That is wonderful, Paula. I see you're going to explain in Spanish. That may be something that we look at bringing you on board for in the future. Nanda, who was covered for unemployment. Well, so let me be sure that what I went over on those slides about unemployment, that is an act currently. That is not a bill yet. So this would change who is covered if it is enacted. Some of the news articles that I read yesterday said they expect the Senate to take this up tomorrow. This is Congress now. This is a federal act. So right now, there are no changes to who's covered for unemployment. But if this is enacted, it would change who is covered. Let's see. Yeah, okay. I see more people that would like slides. Any other questions?
Heather, this is Nanda.
Yes, ma'am.
Please keep us informed. Be the liaison conduit between the hospital bed need. Nationally, hotels have been requested, and kept online to keep open for beds. Please keep me informed. Are there any needs for beds in the future? How do we integrate that where if there are stays from outside, who takes care of that hotel? I have so many questions on that. This needs to be talked about early on, so when we get to that point that we know how to convert the situation into beds of need. It may require a conference call, but I am ready to engage into any conversation on that level.
Sure. I'm going to also add that the VOAD, Etowah County VOAD, Volunteer Organizations Active in Disaster, I believe we'll have a teleconference meeting today. For those of you that are members of the VOAD or want to become members of VOAD, that would be your organization is willing to participate in a disaster, in the disaster response. Craig Scott at the Gadsden Public Library is the chairperson of that. Give me a second, I'll look up the Gadsden Public Library number. They are closed to the public, but they're at work today. And you could give him a call and see if you can get access to that phone call. That's going to be at 3. Now, I want to reiterate that the Chamber in no way is managing or organizing this response. We have an incredible emergency management agency in our area, and we are just trying to push out information specific for our businesses so that we can keep you abreast of what we know to try to keep your businesses afloat and viable while we're going through this. The Gadsden Public Library's phone number is 256-549-4699. And that's their main line. You would ask for Craig Scott, and then he would be able to provide that access information for you. I felt like there was something else that I wanted to mention and I've completely forgotten. Let me go back through these chats. There's a person from Carolyn that said, can I have the slides, please? It doesn't tell me what your last name is. If you would give me your email address, I'll make sure I get them to you. I think that gets all of our questions in chat. Anybody else have anything?
Heather, this is Steve Hildebrand. Are you aware of any foundations, grants, federal money for assistance for nonprofits to help respond to this crisis?
I'm not aware of any. I think probably the best method to go for that information will be through 211 First Call for Help for charitable assistance.
Heather?
Yes.
This is Bart Dawson. Also, we are providing services for disinfecting buildings, and if anybody has a need for that, they're welcome to give me a call at 256-490-4669. We're working with a number of the school systems right now, but we're going to be providing it to individual businesses here shortly. So,
repeat that number for us, Bart.
256-490-4669. I have sent some information to Will, so Will has some documentation that he can send out if he needs to.
Great. We'll have that on the website. If we don't have it on there already, we'll have that on the website very soon. And again, you can access the ongoing list of services that are available for businesses. And again, let me stress, we're collecting information just like Bart described for businesses that are for sale during this time that businesses can access that are related directly to this outbreak. We do still encourage you that if you have any charitable services, any free resources that you're willing to give away, things like that are for charitable purposes, 211 First Call for Help remains our statewide database for resources needed and resources available. And so I just want to be sure I don't create any confusion. We're trying to just collect things that are in our local community that, just like Bart described, that are available to businesses that may be needed, services that may be needed during this time as we move forward. And Bart, I just put your number on there on that chat just in case somebody wanted to pull it off. I see several of you want the slides. We will work to email you all the slides. I'll try to make sure I can get it compressed as tightly as possible. But likely what we are doing, we are recording this session, and we are going to post the session online, and I will email you all the link. And we will, that way you can watch it, pause it, download it if you need to, and use as you see fit. So last call for any other questions. All right, well, I appreciate you guys all tuning in.
Heather, we want to say thank you. This was a lot of work, covered a lot of ground, and I'm completely in awe. Thank you, because there was things there that we did not at all think on. One of them is cash handling. So thank you. Second is, will you make sure that you give us any updates on unemployment when you get it, and where will you be posting it? On your site?
Yes. So again, new information as we have it come available, we go on that ettawachamber.org/COVID-19 page. In addition, when we have significant updates, we'll be sending out invites, just like we did for this one, to additional web conferences. Right now, we're banking on probably offering one per week. If the need arises, we will do them more often. Hopefully, the containment starts ramping up, and we have less to report on. But if they're needed, we're willing to do these daily. So when we do have new updates to send out, we will be sending them through our Chamber Master system. You'll get the invitation just like you got the invitation for this. We will also continue to try to offer identical sessions in the morning and the evening when we do those updates, so that it can fit in different individual schedules. All right, any other questions, folks? And let me just add that it's truly unfortunate that we have to do this, but please know that it's our pleasure to serve our members. We're grateful to be able to offer this service. We love our community, we love our members, and you know we've got you all in our prayers. All right, guys, with that, we're going to conclude this session. Thanks for tuning in.